981. If you have any questions for our guest today in the studio, if you want to find out more, or you have, friends or family who kind of been diagnosed with the disease, or you want to just find out more information, you can call us up in the studio as well. Our telephone lines are open and good to go. It's 014489981. Again, 014489981. You can also send us a WhatsApp message to 009-444-0981. Tweet at us. We're at Smooth981FM on Twitter. And we're trying to stream live on YouTube. Hopefully it works really soon. But in the meantime, you can go on and subscribe to our YouTube channel. It's at, just search for us. We're at Smooth981FM. Okay, now we're good to go. We are on YouTube Live. So go on there and go stream us live on there. www.youtube.com/Smooth981FM. So ladies, let's get started, shall we? And I'm going to come to Dr. Omolola for this very first question. Before we do that, let's kind of clarify or mystify this mystery, behind the dates. When I started Googling and, trying to find out more information to prepare for this interview, the first thing that I noticed the dates were kind of confusing. One information said, World Parkinson's Day was the 11th of April. And then another said it was April 14th. And of course, and then there was a week that's dedicated to awareness. And then before the interview today, I was asking Omotola, I'm kind of confused. What's going on? But hey, you guys help us clarify. When is the day? What is today? And what week is dedicated to the awareness?
You want me to go or?
Yes, I'll let Omotola go first.
Okay, good morning, everyone. Thank you so much again for having us on here, Judith, and thank you to Dr. Omolola for joining us. World Parkinson's Day is April the 11th, and it is that day because it's the day that Dr. James Parkinson was born, and he's the one who recognized Parkinson's disease as a medical condition. So every year on the 11th of April, World Parkinson's Day is celebrated. Now, the week following that is what we use to spread awareness, which is World Parkinson's Week. And then generally, April is just Parkinson's Awareness Month. So I hope that clarifies it a little bit.
It does. Doctor, do you have anything to add to what she said?
So basically, in a summary, she's hit the nail on the head. So the 11th of April is the day, that's the World Parkinson's Day. The week after is the week dedicated to awareness, but in general, the month of April is the Parkinson's Awareness Month. So that's the month of schooling.
And that's it. So let's move on to what exactly is Parkinson's disease, Dr. Omolola?
Okay, so thanks for the question. So Parkinson's disease has a lot of synonyms. So for someone in the UK, you just hear them talk about Parkinson, no disease after it. In the US, they talk about Parkinson disease without the apostrophe S. However, we're all talking about the same disease. And that is, it's a neurodegenerative disease. I'm going to break down that big term. And it's just among the group of diseases that are due to loss of specific cells in the brain. I need to bring that in early because as a general feature, neurodegenerative diseases as of today do not have a cure. They are usually progressive, they are treatable, they are manageable, but as of now, there is no cure. And that is where research is kind of focused at now. Now, honing down on Parkinson's disease, it is that disease that is characterized by slowness, stiffness, a tremor, so shaking of a part of the body, especially that occurs at rest, and with time, instability of gait. So in medical terms, we call that bradykinesia, rigidity, rest tremor, and postural instability. This constellation of signs is actually Parkinsonism, which is, it's a feature even lay people who have been exposed to people who have the disease will recognize it on the street, on the corridor, anywhere. We use the term Parkinson's disease when those constellation of features are thought to not arise from any other disease. So in other words, Parkinson's disease is a neurodegenerative disease of the brain, usually occurring in elderly people, but not specific to elderly people, as Omotola will tell us later, characterized by slowness, stiffness, shaking of the part of the body, and instability of walking.
And instability of working. We're going to take a break here. When we come back on the other side, Omotola is going to tell us a bit about our discovery story, and how she found out about, her diagnosis and her disease. But stay with us. This is Smooth 98.1, Love Music, Love Life. This is Lagos Talks at 981 special. We're talking World Parkinson's Days, raising awareness in Parkinson's in Africa. Don't go anywhere. Stay with us.
Future forward banking.
Okay, so we'll be back shortly, and then when we come back, we'll start with you, Omotola. But Dr. Omolola, I think there's a fan in front of you, so we're hearing the wind. It's feedback.
Okay, I'll switch it off.
Okay, because it's
right.
moving. You can make it stationary, but maybe face to another side, so it's not moving. Yeah.
Okay, it is stationary.
Okay, but like not facing you and your laptop, maybe to the other side.
Providus Bank for you to take care of your daily experiences. At Providus Bank, we believe that banking should be all about and your business and how to get you to the next level. If you do not already have a Providus Bank account, please speak with our business concierge on 0700 77.
Is it good now?
Much better.
Or email business concierge at Providus Bank.
Much better.
To switch to a future.
Okay, we're going back in.
Experience. Providus Bank. Future forward banking.
Come lunchtime on Smooth 98.1, we serve you world music. Travel Africa and the rest of the world as we bring you the smoothest collections of traditional rhythm. It's a rich blend of strings, percussions, wind instruments, and voices. Indulge yourself and go beyond the music.
The greatest activity in music happened during the apartheid era, and great musicians came up out of that era.
Discover unique sounds of places, people, and culture, and come alive in your soul. It's a taste.
We have 6 seconds. We're going in now. Studio.
98.1. From one.
Providus Bank. Future forward banking.
We're going in. Studio. Smooth 98.1, Love Music, Love Life. You're welcome back. This is Lagos Talks 981 inside of Smooth Breakfast. My name is Judith Atibi. My guest today, joining me live via Zoom, is Dr. Omolara Ojo, and of course, Omotola Thomas. She is the founder of Parkinson's Africa Initiative and also an advocate for the disease as well. As she joins us here today, we are trying to create awareness on World, today being, or 11th of April being World Parkinson's Day, and the entire week and also even the month of April is dedicated to raising awareness about this disease. Earlier before the break, we had Dr. Omolara who talked to us about what exactly this disease is. But Omotola, I'm going to come to you to ask you, tell us a bit about your discovery story. What were your symptoms and what was the beginning stage like for you? I find that when people share their personal story, it kind of helps us personify, makes us understand a bit better, to separate the medical terms from it, and make it very easy for the layman. But hey, Omotola, you have the floor.
Thank you again, Judith. My first symptoms started, I think, around 2010. I was about 30 years old at the time. It was a slight twitch in my forefinger, and I dismissed it because I just assumed it was due to stress. There was a lot going on in my life at the time, and I thought it would go away. Of course, it did not go away. The twitch became a tremor, and then it spread from one finger to the other, and it jumped to the other hand. I was living in the US at the time, and I saw so many different doctors, and all of them kept telling me, it's nothing to worry about. You have essential tremors, it'll go away or it won't go away. One way or the other, you'll be fine. For the next 5 years, the journey of searching for a diagnosis went on. I went to see many different doctors, had many different scans, blood tests. I got tested for practically everything under the sun. And then my symptoms started to progress from the tremors. I started experiencing rigidity and stiffness, muscle weakness, and then I lost my sense of smell. At a point in time, it became really, really difficult because there were so many different symptoms occurring over time. Finally, towards the end of 2015, we had moved to South Africa at this time. I went to see a doctor, and he told me, he was the first doctor after 5 years of trying to figure out what was going on. I said, look, I think you have some form of Parkinsonism, but your race, your gender, and your age make it very difficult for me to diagnose you. And then he recommended that I go to the UK to get seen by a movement disorder specialist, which I did middle of June 2016. And after I came here to the UK where I live now, I had a brain scan, they evaluated me clinically, and I got diagnosed at the age of 35.
Wow. Besides the symptoms that you've just spoke about, are there other symptoms excluded the ones you experienced? Because I know when I was Googling, I mean, Google is my friend at this point. I found this 5 stages. It's called 5 stages, and got me really intrigued. And I'd like the both of you to take the floor. But Omotola, I'm going to start with you, continue with you. Are there other symptoms as well?
I am so glad you asked that question. So the 4 main symptoms, were very excellently described by Dr. Ojo, which are the tremors, which is one of my prominent symptoms, features, rigidity, slowness, and postural instability. But what people don't talk about a lot, which are often more debilitating than the things that you see, are the non-motor symptoms, the pain, apathy, depression, anxiety, impaired handwriting. So, these are non-motor symptoms that are very difficult to understand, even for the person dealing with the illness, much less for people on the outside that you can't see anxiety, you can't see depression. It's not something that's easy to understand. So I'm very happy that we're also bringing awareness to non-motor symptoms of Parkinson's disease.
Dr. Ojo.
Yeah, thank you, Mr. Atibi. So as I'm just going to do a follow-up on what Omotola has said, and she has described it well. So for many years, Parkinsonism or Parkinson's disease was mainly characterized as this problem with movement. It was motor symptoms that were well recognized. It was the motor symptoms that defined the illness. But in the last decade, the non-motor symptoms have been identified as actually more problematic for the patients. And there are many reasons for this. Now, we need to recognize that I gave the background, loss of cells in the brain. For Parkinson's disease, this has been characteristically the loss of a neurotransmitter. So neurotransmitters are like chemical messengers that allow our body to function. So the particular chemical messenger that is lost in Parkinson's disease is dopamine. And what dopamine does is to signal your body to move. You understand all the little movements you're having in the studio now. That's the work of dopamine. So you can imagine somebody who loses dopamine and cannot have subtle movements, cannot have voluntary movements, they cannot have automatic movements. However, apart from those movements are the involvement of other parts of the brain. Involvement of the brain involved in smell. And that's why Omotola mentioned losing her sense of smell. And for elderly people that we diagnose with Parkinson's disease, one of the things we've found consistently is that for many years before they develop their first Parkinson's symptom, they would have had loss of smell, but they don't think of it as anything, or it doesn't impair their activities of daily living. So they just live with it. Okay. And other chemical messengers are now recognized to also be lost, as well as the dopamine. And that's what results in the anxiety. Some of them have apathy. Some of them are depressed. Some of them have pain that is not of musculoskeletal origin. They just can't place it, but they are in pain. Some of them have difficulty sleeping. Some of them sleep too much during the day. So all these things are things that actually impair them more than their motor symptoms. And sometimes they are perplexed because they can't place it in the context of the Parkinson's. So what the awareness is about now is not just for patients to note and report the symptoms, but also for neurologists, for physicians, for GPs who are seeing these patients to ask about these motor symptoms when they are also talking about the tremors and the slowness. It is intriguing that you brought up the 5 stages of the disease. They are a way of us characterizing the severity and disability, especially of the disease. However, the way one person moves through the 5 stages differs. So you cannot put a formula to it that, oh, this is the way Omotola is going to move through it. This is the way Mr. B is going to move through it. No. So for the first stage, the person just has symptoms on one side of the body. So whether it is the tremor, it is the stiffness, or it's the slowness, or a constellation, it's on one side of the body. For the second stage, it's on both sides of the body. However, the person's balance is still intact. By the third stage, they have symptoms on both sides of the body and their balance is lost, but they are still a bit independent. By the 4th and 5th stages, they've lost independence. By 5th stage, they're already wheelchair bound. So it just gives you an idea of how the disease progresses over time.
I really want to stick with you here on, trauma and the progression, but I want to take us back to, diagnosing this disease. And I want to come to you first, Omotola, for this and share with us extensively, because it took 5 years from your first, twitch of finger of you feeling that trauma all the way to when you were 35. And I can only imagine how gruesome, that experience must be for you. But again, just extensively, just take your time and share with us how it was, to finally get a diagnosis on this disease.
Thank you so much. I will do that. I just wanted to add one real quick thing to what you just said. In terms of the non-motor symptoms, like people can see my hands are shaking, right? So and empathize with that, if somebody, and they can see that I have slowness of movement. So if somebody says, please pass me that glass of water, if I'm slow or I spill the water, they don't get upset with me because they can physically see. Well, you can't see my anxiety, you can't see my apathy. So this is really more to the family members and to the caregivers and to the outside world. You cannot see that my brain is, I have impairment, that my brain is impaired in terms of my ability to focus and to, make decisions and remember things. So it's important that people understand that just because you can't see it doesn't mean it's not there. On the question that you asked me, it was very difficult, quite frankly. I literally thought that my body was falling apart into different pieces because, today it's one symptom, to the next it's another symptom. But interestingly, by the time I actually got diagnosed, I don't know if it's because I was tired of getting tested for one thing or another, or because I finally had an umbrella term for all these very different symptoms that were occurring. When I got diagnosed, I didn't feel sad. I wasn't happy, obviously, but I wasn't sad. I wasn't anxious. That doesn't mean that I was excited. I was calm. I was determined not to let this illness get the best of me. I think I had gone through enough symptoms for a long time to be able to get accustomed to the idea of having Parkinson's. You said Google is your friend. Google was my friend throughout those 5 years. Google already told me before the doctors actually told me that I might have Parkinson's. So I had enough time to deal with it and to be able to accept the possibility. So that on the day that I actually got diagnosed, I remember very clearly deciding that I was not going to let the illness get the best of me. I was going to do my best to use it as a platform to encourage myself and to encourage others to not let adversity get them down, and to really find opportunities in adversity. And I think that mindset is what has helped me over the last 4 years and brought me to where I am today.
Mm. And that's really great. You're such an advocate there. We are almost out of time. I'm going to quickly go on a very short break. It's not going to be for too long, but you can be part of the show. I see all your WhatsApp messages coming in. Please send them on 0809-444-0981. When we come back, I'm going to ask our guest, Dr. Omolola Ojo, about the diagnosis here in Nigeria and what the process is. And, and do we see many of those cases of people coming and the old mysticism around it, when it comes to Africa and our religion, and of course there's also the part of juju or najaz. Stay with us. This is Smooth at 98.1. Love music, love life. This is Lagos Talks at 981 special. Don't go anywhere.
Future forward banking.
All right, so we'll come back. We'll take that question, and okay. So when we take that question, we will quickly talk about. I think you've already shared your experience on what the trauma is like. Then we'll talk about a cure for it. Is there a cure? What's the treatment? What's the management? And then we'll just, navigate and take it from there, right? This next we're coming back in is longer, so we have more time to talk. Because again, we have to pay bills.
Of course.
Understood.
Dr. Ojo, are you taking the one on jazz and spirituality?
Yeah.
I'll talk about it because it's not peculiar. It's not peculiar to Parkinson's. It's just our nature.
Yeah, the African, the Nigerian mentality.
Yeah, and it's unbelievable, even with very outstanding levels of education, what people will believe when there is no cure for something.
Absolutely.
You are absolutely correct. All right. I'll take some messages here. Father C from Eric Moore. Going in studio. Smooth 98.1. Love music, love life. You are welcome back right here inside of Lagos Talks at 981 inside of Smooth Breakfast. My name is Judith Atibi. My guest joining me live via Zoom is Omotola Thomas. She is the founder of Parkinson's Africa and also a Parkinson's disease advocate, living with the disease and advocating for awareness here in Africa. And also we have Dr. Omolola Ojo. She's a consultant neurologist with Luth, and they're here today to share awareness as we discuss World Parkinson's Day today. Now, to be part of the show, as always, you can always send us a WhatsApp message to 009-444-0981. I have messages here. This is Sheyi, and Sheyi goes, "Good morning. Thank you for speaking about this. I'd like to ask, is there a chance of the disease being hereditary? And is there a traceable cause to this disease?" That's a very good question there. I have one more here. This is from Fadonsi from Eric Moore. And it goes, "Good morning, doctors." Okay, so there's one doctor and there's one advocate. And he goes, "Well, the simple truth of the matter is that I am not a health worker, although I am surrounded by cousins and siblings who are professionals in the medical field. All I know about your profession is the little chemistry and biology I learned at school. I know that the late President Ronald of United States of blessed memory lived with both Parkinson's and Alzheimer's disease after the fight between Muhammad Ali and Larry Holmes, Cassius Clay was diagnosed with Parkinson's, which he never recovered from before he died. All the shaking and restlessness attributed to Parkinson's are so notorious. Even some of the side effects of taking medication for schizophrenia manifest Parkinson's symptoms. One thing that I would love to know is what causes Parkinson's, because it was so painful to lose a champ like Muhammad Ali to Parkinson's disease. Doctor, you have quite other questions here for you today.
Yeah, thank you for the questions, and thank you for being on the program, and thank you for being interested in the topic. It just shows that the month and the week are achieving their aims. Now, I'm going to start with the latter question, which was from Father Unsi, I think.
No, it's
And
from Shay.
yes, from the latter one, the second
Yes.
one.
Oh,
So
yes. Yeah.
I'm going to start with that. And as I said at the beginning of the program, Parkinson's disease is caused by neurodegeneration. Neurodegeneration meaning, for one reason we do not know, parts of the brain suddenly stop working. For Parkinson's disease, the cells that produce the chemical messenger dopamine start dying off, and the amount of dopamine that is needed to signal movement in the body starts getting reduced over time. That is as simply as I can put it. Now, you have mentioned two popular people who were in the public eye. Muhammad Ali's disease was there for everybody to see. And it was so great to see him during the 96 Olympics with the disease and still able to light the Olympic torch. And it just passes a message that even when you are dealing with non-curable diseases, you can still live your life. And that is the essence of early diagnosis and the essence of management. We all know medications have side effects. I keep telling people that if they know the side effects of paracetamol, they will not go near it. But the truth of the matter is, when you have an illness and there's a treatment for it, the risk-benefit ratio is towards the side of taking that medication. I'm going to give a small correction here. Ronald Reagan had Alzheimer's disease. The thing with Alzheimer's disease is that towards the end of the disease, by the time they are very much advanced in the disease, they also develop features of Parkinsonism. That doesn't mean they have Parkinson's disease. Ronald Reagan had Alzheimer's.
Okay.
Okay. Then for Sheyi asked about the chance of Parkinson's being hereditary. So less than 10% of all Parkinson's disease are actually hereditary. Hereditary meaning, in this point, there's a genetic reason for the Parkinson's disease. We only find that in less than 10% of all Parkinson's. The more likely risk factors for Parkinson's disease are age. So the older one gets, especially in the elderly population, people over 60, 65 years, at least 1% of them will develop Parkinson's disease in their lifetime. The reason Omotola's diagnosis took so long is because, one, it was young onset Parkinson's disease. So young onset Parkinson's disease is Parkinson's disease occurring less than 40 years. And then because most likely she was in the US and they had not seen people of African descent. Now, strict Nigerians. She's not mixed. She's not mixed ethnicity. She's a pure African. And they were a bit stumped at that. Do Africans really have these diseases? The answer is yes. And the rate at which we are developing these chronic non-communicable diseases is now very fast. One, because we are living longer. Secondly, because of improvements in diagnosis. So we keep saying we don't have enough of medical personnel, we don't have enough, but we still have more than we had 50 years ago. Training has improved. So Omotola mentioned seeing a movement disorder specialist. I am a movement disorder specialist. So in addition to my neurology, I did movement disorder fellowship. And there's another person in Lagos at my institution. So there are two of us in Lagos, and I'm aware there are others around the country. So these specialists are not as scarce or unavailable as people think. Yes, the access is reduced compared to other countries, but it's not strictly unavailable.
All right, let's quickly talk about, the misconceptions again in Africa. Our last question before we went on the break, and what the mindset or our mentality as Africans, seeing these cases and, attributing it to either, witchcraft or, I mean, I could go on and on about it. How would you address that situation?
That's $1 million question. And any physician practicing in Africa, any physician practicing in Nigeria will tell you that is something they need to address every day. The African in us thinks that everything bad has an alternate reason. It is from the family member that does not like you. It is from spiritual reasons. And we are a faith and religion-based culture. So sometimes you really need to sit down and give culturally appropriate counseling for people to listen to you and take your message. Because the truth of the matter is you can counsel your patient. You can tell your patient, oh, this is what it is. You need to take drugs and everything. And at the end of the week, by the time they are in their religious organization, they are being told that, oh, if they take the drug, it means they are accepting their condition. So we are working at loggerheads. However, because of improvements in health literacy, no matter how little it is, and because medicine, the practice of medicine has gone beyond just shoving a prescription in front of a patient. You need to talk to your patient. You need to tell him what the disease is like. You need to tell him what others are going through. You need to talk to him about treatments, even outside of the medication you are prescribing. More and more people they still struggle with it, but they are erring on the side of caution. And we need to improve the numbers that will know the myths, but still present to the health professional to get the appropriate help. So the myths are there. Apart from the juju and the jazz and everything, there's also the myth that diseases like Parkinson's and dementia are aging. They are just natural aging. So people think their elderly
It's old
parents,
age. Yeah.
yeah, old age. Why do I need to take her to the hospital? But the truth of the matter is it goes beyond the shaking and the movement, as Omotola has said. And one of the other accompaniments that she mentioned is the caregiver burden. It is unquantifiable. If you are living with somebody who has the disease and you are taking care of somebody who has the disease, be you a spouse or a parent or a child, they cannot put the impact of this disease, they cannot put it into words. So many times we are treating the patient, we are treating the family members who are the caregivers.
All right. Omotola, I'm going to come to you for this next question. And it kind of circles back to what Fadonsi was saying about management and also what Dr. Omolola was explaining about seeing the Muhammad Ali lighting up the 1996 Olympics torch, with the disease. And you have been able to manage it. But share with us how you've been managing and living with it so far, all these years.
I will, but just two quick things to follow up on what Dr. Ojo said. I agree completely with her on the issue of medication. When I got diagnosed in 2016, I didn't take medication for almost 2 years because I kept believing that I was going to be healed and something would happen. And like she said, I felt like taking the medication had a negative impact on my faith. If I take that medication, that means I don't believe that God will heal me or something like that. And I lost time, precious time, because everybody knows that exercise is one of the best things you can do when you have Parkinson's. But because I was rigid and I was stiff and I wasn't taking medication, I wasn't able to exercise. So I believe that I lost precious time in helping myself along the disease. And then the second thing was families are suffering because of these misconceptions and cultural beliefs. I have people that I work with that have told me that I have a person in Uganda whose mother died having Parkinson's disease, and his father actually, out of care and concern for the children, took them away from the family house because he didn't want the mother to infect them with her witchcraft or with whatever was going with, not because he didn't love the mother, but he was trying to protect his children, and he took them and they left their mother and they left her to literally almost die on her own. This is one of the reasons why we're doing this awareness, to let people know that this is a manageable, treatable condition. You asked me a question about how I've been able to manage the disease. Family support is so important. I could not have done half of the things that I'm able to do now without the support of my family. So it's important that those who have this illness, find some type of family support. And if you don't have family support, Parkinson's Africa has virtual support programs that we're working with people to support them and to give them hope. For me, and this is a very personal thing, it depends on the individual. For me, silence equals subjugation. I knew that if I kept silent, the disease will get the better part of me. So even though it was not culturally, it was not what we do culturally, because I remember when I wanted to start talking about my illness, I had some family members very legitimately concerned, we don't do this, we don't talk about these things publicly, especially an illness that doesn't have a known cause or cure and presents itself with funny looking movements like my tremors. We tend to want to hide it, but I knew that I couldn't. I feel empowered when I'm able to take a stand and say, look, in spite of my vulnerabilities, in spite of my illness, in spite of my challenges, I can still stand up and I can still make a difference. That's how I've been able to manage it, is in the process of trying to give hope to others, I myself am encouraged.
And you're by far the strongest person I know. We're going to take a break. When we come back, it's going to be the last leg of the Lagos Talks 981 special. We're talking World Parkinson's Day, raising awareness for everyone today. My guest in the studio is Omotola, Omotola Thomas. She is the president, or better still, the founder of Parkinson's Africa Initiative, and of course, an advocate for Parkinson's disease. And also, my second guest in the studio is Dr. Omolara Ojo. She's a consultant neurologist at LUTH and also a senior lecturer at College of Medicine, University of Lagos. We're streaming live on YouTube. Go on and check us out. Let's take a quick break. When we come back on the other side, it's going to be more. Don't go anywhere. This is Smooth Breakfast. I can't hear myself. Is there something wrong with this thing? Sorry, we're having a technical problem here. I don't know what's wrong with the board. All right, so we're coming back for the last leg, and I'm going to come to Dr. Ojo, and I'll just ask her, what the treatment plan is. What is there a management process like, and then final words, how can people reach you? Also, stigmatization, just really to tie things up nicely towards the end, right? And also, if you guys have anything that I missed out in the course of the interview that you want to address, you have the floor to do it at the last bit.
Okay.
Okay, cool. Well done.
Lagos traffic in the evenings can be such a joy all around entertainment in the company of smooth, dynamic maestros and let music be your
All right, we're going in.
your smooth drive home with soothing soul music, spicy jazz, fuel toppings, blues, and everything that's radio friendly you enjoy. Smooth drive weekday from 4 p.m.
All right, we're going in. Studio. I would let the beat drop, but we're almost out of time. You are welcome back. This is Lagos Talks 981. We are now inside our last leg of the show today. This is last round for the show. If you haven't sent in your WhatsApp messages, go ahead and do so because we're rounding things up to have questions for our guests. But if you're just tuning in, you're welcome and you are late. Well, you can catch the replay on YouTube and also join us there because we're streaming live on YouTube. It's www.youtube.com/smooth981fm. Today on Lagos Talks is a very special one. We're talking about World Parkinson's Disease Day. It's a day today, or rather it was on the 11th actually, and this entire week is dedicated to raising awareness. And the month is all about Parkinson's disease to raise awareness. And so that's what we're doing here in the studio. My guest with me, joining me live via Zoom. If you're on YouTube, Omotola Thomas, advocate and also the founder of Parkinson's Africa Initiative, and also we have Dr. Omolola Ojo. She's a consultant neurologist at Luth and also a senior lecturer at the College of Medicine, University of Lagos. Now, because we're going to round things up really quickly, and before the break, Omotola was talking a bit about how she's been able to manage the disease so far from her diagnosis until now. But Dr. Molara, the question really is all hope lost? Is there a cure? Is it just going to a treatment process or a way that one can manage it, throughout life and live a long, healthy life?
Yes, thank you very much for that question. Yes, there is treatment. So the fact that a disease doesn't have a cure doesn't mean it doesn't have a treatment or a management process. Very briefly, I'm going to talk about diagnosis, and that's because Omotola introduced the fact that she had extensive testing before her diagnosis was made. So we do not really need that much extensive testing for a diagnosis of before a diagnosis of Parkinson's disease is made. Was a peculiar case because, as she introduced, she was a Nigerian living outside the country. She was young, and she was not in the typical age group or the typical ethnicity for those places for a Parkinson's disease to be made. So the disease diagnosis is mainly clinical. Clinical meaning you see a neurologist. In fact, even our GPs are sensitized to pick a patient with Parkinsonism. So it is the recognition of Parkinsonism that leads to a diagnosis of Parkinson's disease. Now, that said, if somebody like Omotola had presented in Nigeria, we would still have done as extensive a test or as extensive testing as the conditions in Nigeria would have allowed. And what's the reason for that? The reason is that Omotola fits the bill for young onset Parkinson's disease. And when you have patients who have young onset Parkinsonism, you have to be absolutely sure that you are not missing an alternative cause, a treatable cause, a curable cause for their Parkinsonism. Now, that said, what do we do for treatment? The aim of treatment is not just to get patients to keep swallowing a tablet. for the rest of their lives. No, it goes beyond that. It's about keeping them as functional as possible for as long as possible. It's about keeping them as independent as possible for as long as possible. So for a disease like Parkinson's disease, what will this entail? Omotola was spot on when she mentioned family support. It is very crucial when you are dealing with diseases that are neurodegenerative, that are chronic, that are not curable. One of the essential things with Parkinson's is physical therapy or exercise. And if you Google, you keep saying Google is your friend. If you keep Googling treatment for neurodegenerative diseases or prevention of neurodegenerative disease, one of the themes you will see that keeps recurring is that of exercise, even for people who do not have the disease. So this is an essential cornerstone of the management of Parkinson's disease. Many times patients can institute this on their own, especially if they're still in the early stages. But for somebody that was far along, like Omotola, and she explained it, she was already stiff. She was so stiff, she could barely move, and then you are telling the person to start exercising. It's like contrary advice. So depending on the stage you're catching the patient, for some early patients, they can be on exercise for a while. And when their symptoms start impairing their day-to-day activities, then you start them on medications. Now, because this is a radio show, I won't be able to mention specific medications, but the cornerstone of the medications is to replace what is lost in the brain. So all medications targeted towards the treatment of Parkinson's disease, especially the symptoms of Parkinsonism, they target replacing the lost chemical messenger, which is dopamine. However, remember that earlier in the show, we mentioned non-motor symptoms. So if you have a patient who has Parkinson's, who also has apathy, who has Parkinson's, who also has depression, who has anxiety, all these need to be managed along with the Parkinson's disease. So Parkinson's disease is no longer the purview of the movement disorder specialist only, or the purview of the neurologist only. As with all diseases now, it needs multidisciplinary management. The neurologist has a role, the physical therapist has a role, the occupational therapist has a role, the dietitian has a role. And sometimes this is where we are limited in this part of the world. However, even with those limitations, all these people are available. You just need to know where they are and get your patients to them. You also need to anticipate complications. You need to anticipate progression and complications, because sometimes patients are ashamed to tell you about their symptoms. So somebody has had Parkinson's disease for 10 years and starts hallucinating. He doesn't want to tell you because he thinks you are going to think he's crazy. But if you ask the question, and this speaks to the skill and the rapport you have developed with that patient over the years. If you ask the question, then he knows, oh, doctor, it's as if you are living with me. Yes, this thing has been going on. I know it's not real, but I was scared to tell you so that you don't think I'm a candidate for the psychiatric clinic. And then you can institute treatment for that. So for the listeners, it needs early diagnosis, meaning that something occurs to you. You think it is not part of you. This has not been me. Present to a health professional. If you think you have Parkinson's, you have not seen a neurologist, ask your physician for a referral to see a neurologist. Lagos State has the highest number of neurologists in the country right now. Okay. And if you need to see a movement disorder specialist, we do have a movement disorder clinic at the Lagos University Teaching Hospital. I'll hand over to if she has anything.
Omotola, do you have anything to add to Dr. Ujo's things take here as we end the show today?
Yes, just a few closing thoughts. Thank you again for this wonderful platform. I'd like to let everyone know that Parkinson's Africa is an organization that was established to promote empowered living for Africans impacted by Parkinson's. And to do that, we really need to find a way to inspire hope, and we're trying. We're creating educational materials in 11 different African languages to make information, education, and resources more accessible to Africans who are impacted. We're putting together virtual support groups so that people can come online, talk to each other, and not feel alone. And I would just like to share one last real quick thing before we end. And it was the day before I got diagnosed. I remember sitting here, in the room, and I knew that I was going to get diagnosed the next day. And I went on Google and I was looking for faith. And I came across a quote by the name of a man called Patrick Overton. And this quote has literally guided me throughout my entire journey with this illness. And the quote says, "When you have come to the end of all the light that you know, and you're about to enter into the darkness of the unknown, faith is knowing that one of two things will happen. You will either find something solid to stand on, or you'll be taught to fly." And in that night, I just knew that somehow or the other, I was going to fly.
And that's the best way to end the show. Thank you so much, guys, for joining us here today. It's been wonderful. That's Omotola Thomas. She is the founder of Parkinson's Africa Initiative and also a Parkinson's disease advocate. And of course, my second guest here is Dr. Omolola Ojo, consultant neurologist at Luth and also a senior lecturer at College of Medicine, University of Lagos. How can they find you and also the initiative as well? How can our listeners reach out to you, Omotola?
Easiest way is parkinsonsafrica.com. And there's a contact. Parkinsonsafrica.com or omotola@parkinsonsafrica.com. That's my email address.
That's our email address. And Dr. Ojo, how can they reach out to you?
So they should reach out to the Movement Disorders Clinic of the Lagos University Teaching Hospital or the Neurology Clinic of the Lagos University Teaching Hospital.
And that brings us to the very end of the show. Thank you so much for coming on board this early in the morning. Thank you for joining us. Catch a replay of the entire episode. It's going to be live on our YouTube. You can catch everything and watch it, and also reach out to them as much as you can. And also avail yourself as much information as you can. Also, be kind to people, all right? Be kind. And that brings us to the very end. More music coming up on the other side. It's going to be more music to get you in the mood for Hump of the Week Wednesday. This is Smooth Breakfast. My name is Judith Atibi. Don't go anywhere.